Someone has one.
I can hear what's the
No, transport. Yeah, the transportation committee.
I think you should totally do that. Because I mentioned how good that would be. Yeah, he gets
to get a card if you're not I mean, yeah, I'll probably say
and it's just sort of there, which makes it even worse. Because as we said, they're just sort of sitting there. So like, just sort of sitting there. It's like, why did we
If we could find our seats, we'll begin. Once everybody is here. Before we start, if you want to be recorded, please, you're going to have to speak into the microphone, and then we're going to pass the mics around and push the switch up to red to turn it on. So if you want to be recorded, we're going to have to use the microphone and push the switch up to red, and we're ready to go. We're ready to start. The meeting will come to order. I'm pleased to be able to hold this subcommittee roundtable here in Somerset, Pennsylvania. I want to thank County Commissioner Walker and the other county commissioners for making this space available to us. And I'd also like to thank Congressman Rothfuss for welcoming us to his district. And I'm glad he's able to join us here today. And lastly, I want to thank all the participants here. We have federal, state, local, and private sector representatives participating today. When we began to plan this roundtable, it was clear from the overwhelming response how important this topic is. Opioid abuse has impacted all facets of our communities. As chairman of the subcommittee with oversight of economic development, programs, public buildings, and FEMA, I did not expect our committee would have a role in helping to address this crisis. This changed when reports began to come out indicating that opioids were creating additional hurdles to jobs, job creation, and economic development. Last year, a report commissioned by the Appalachian Regional Commission detailed the impact of the opioid crisis on economic development and jobs. In December, we held a hearing focusing specifically on the report and the role of federal economic development agencies in helping to combat drug abuse. Following the hearing, I introduced H.R. 5294, the Treating Barriers to Prosperity Act of 2018, along with the ranking member of our subcommittee, Ms. Titus. I am pleased Congressman Rothfuss joined us as a co-sponsor. This legislation is designed to strengthen and clarify the role of the ARC in addressing the challenges opioids have created to economic development. I am pleased this legislation passed the House and hope that the Senate will take this legislation up soon. Today, the purpose of the roundtable is to have a more in-depth discussion about what we can do now to address the challenges to economic development created by the opioid epidemic. Specifically, we want to focus on the scope of the problem, potential solutions, and the role federal agencies like ARC and EDA play in those solutions. The opioid crisis has touched the lives of countless Americans. This crisis has taken the lives of far too many of our nation's citizens and has had significant adverse effects on our economy and labor force participation. The opioid epidemic has profoundly affected all communities and uprooted the lives of so many of our constituents. 91 Americans die every single day from an opioid overdose. Here in Pennsylvania, over 4,600 drug-related overdose deaths were reported in 2016. In 2015, there were 5,594 overdose deaths in Appalachia, a drug-related death rate 65% higher than the rest of the nation. 69% of these deaths were caused by opioids. An overwhelming majority of these deaths throughout Appalachia were individuals between the ages of 25 and 44, people who were in the prime working years. These troubling statistics make it clear that the opioid crisis is not only destroying lives, it has created a challenge to workforce expansion and economic development throughout the Appalachia and here in Pennsylvania. This crisis is economically disastrous for our nation. Last year, the White House Office of Economic Advisors released a report that estimated opioid abuse cost our nation $504 billion in 2015. That is an important number to remember as we begin today's roundtable because it points to the lost potential for economic activity and productivity in communities battling opioid addiction. That is our focus here today. I hope this roundtable format will help facilitate a good discussion. I want to thank everyone again for being here. And before we begin our discussion, I'd like to recognize Congressman Keith for any opening remarks he may have.
I want to thank Chairman Barletta for making the trip here to Somerset County. Locals call this America's County. This is a remarkable part of the country, remarkable part of the state. We recently celebrated yet another anniversary of the Q Creek recovery of the miners and how that inspired the nation. Of course, we're just up the road, it's Flight 93. And the heroism we saw from local people as they responded, particularly I think of the work of our local coroner. We all know what this opioid epidemic has done to Somerset County, Cambria County, Western Pennsylvania, Appalachia, the state, the country. It is a story of heartbreak, it's a story of frustration, I talk about this being an all hands on deck crisis. We certainly have seen a lot of activity in the House of Representatives recently, passing over 70 pieces of legislation, broadly bipartisan. This is one thing that, we talk about all the division in our country and in our government, but when you talk about this crisis, people are responding across the board, across the Capitol, across parties, across the federal, state, and local levels. So it's great to be here to listen to some of our local stakeholders that represent various aspects of our community, government and non-government. And I look forward to a good discussion, and I really am grateful that we've had visitors from some of our federal agencies coming in from out of the area to have this conversation as well. So thank you, Chairman. I yield back.
Thank you, Congressman. So how is this roundtable going to work? First, I'd like to go around the table for quick introductions, stating your name, title, and organization. The purpose of the roundtable is to have a discussion, so I urge you to join in as we move throughout the topics. I have some questions to help guide us, but I don't want to monopolize the time, so let's begin with quick introductions. I am Chairman Barletta, and I represent the 11th District of Pennsylvania.
Keith Roth, 12th Congressional District.
I'm Tim Thomas. I'm the federal co-chairman of the Appalachian Regional Commission.
My name is Dennis Albert. I'm the Deputy Assistant Secretary for Regional Affairs at the U.S. Economic Development Administration, part of the U.S. Department of Commerce.
Hi, I'm Rob Gillio. I'm a physician who happens to be the Director of Clinical Innovation and Population Health at the J.C. Blair Hospital System, which is in Huntington, Pennsylvania, about an hour and 45 minutes up the road.
I'm Sean Kaufman. I'm the HR Director with Riggs Industries.
Rod Alden, I'm the Executive Director of the Somerset County Chamber of Commerce.
Steve Hauser, Executive Director for the Southern Alleghenies Planning and Development Commission. We're the EDD, LDD, and also the Workforce Development Board for the region.
I'm Gerald Walker. I'm Chairman of the Somerset County Board of Commissioners.
Andrew Rush, Chief Executive Officer, Somerset Hospital.
Carl Metzger, State Representative of Somerset and Bedford Counties.
Pat Stefano, State Senator, 32nd District, Somerset, Fayette, and Westmoreland Counties.
I want to start off with, thank you again for all of you for being here. I want to start off with defining the problem. Mr. Thomas, can you give us a quick overview of how the opioid problem got on ARC's radar in terms of economic and development? And before you start, again, this is going to be free-flowing, so anyone has anything to add or any comments, let's just try to get a full, good conversation so that all opinions could be heard.
Well, thank you, Chairman Barletta. And before I answer, just let me again express my gratitude for your support on this issue, your interest in what the Commission can do to help address this serious problem of the Appalachian region. And the legislation you mentioned that has passed the House, H.R. 5294, it does align very well with the objectives of the Commission, and it will certainly help us in our mission and our desire to address the opioid problem. So thank you very much for carrying that legislation. ARC really first became aware of the opioid challenge about 10 years ago. ARC had actually commissioned a study and collected some data, and as part of that study, it became apparent that the Appalachian region had a markedly high rate of hospital admissions. Hospital admissions for opioid overdose, markedly high compared to the rest of the country. And not only that, the rate was increasing, and this study was conducted in 2008. And roughly contemporaneous with that, we started hearing anecdotal reports from our local partners, private industry, local development districts, that the opioid epidemic and addiction was actually starting to have an impact on the availability of the workforce. Employers were simply having a hard time filling open slots. They were having a hard time getting people to pass initial drug tests for employment, and they were also losing a large number of their employees to random drug tests. And again, a lot of this stems back to opioids specifically. So ARC has been aware of the situation for a number of years. We have seen it grow. And unfortunately, it has not stayed contained within Appalachia, but as you know, has spread beyond the region. ARC has been active in helping compile data to show the extent of the problem. You really can't define a problem until you have data to support that, and that is, I think, been at this point one of ARC's most beneficial contributions to the effort is actually supplying the data to show the extent of the problem. And then that allows solutions to be developed around the data. So,
Yeah, are you seeing any differences in different parts of Appalachia? I know we hear a lot about, obviously, Western PA, West Virginia, Eastern Kentucky, Ohio. What about further south, Alabama? Even up north, I know New Hampshire has had a very, among the most challenging spots in the country as well.
well, speaking to the region specifically, yes, this problem has extended south. We do have problems, not as great and not to the extent that we see in Central Appalachia and in Appalachian Pennsylvania, but Alabama and Mississippi also report problems relative to addiction. Sometimes the problem varies by the area of Appalachia you're talking about. Sometimes it's more opiate and prescription based. Sometimes it's more illegal drug based. But the problems of addiction spread broadly. Yes, sir.
This question is for everyone at the table. What has been the impact of opioid abuse on attracting businesses and jobs, and what has been the impact on the workforce?
I can get us started and then pass it over. I think, like ARC at the Economic Development Administration, about 10 years ago, we also started to hear kind of anecdotally about the impacts to businesses that were unable to find employees. And unfortunately, that has continued to spread. And while it's become a very acute problem here in the Appalachian region, we're not seeing that same anecdotal evidence nationwide. I've traveled about the country and recently heard a number of stories in the Midwest and old industrial sectors that have also been impacted. So I think we're continuing to see rather significant impacts. Unquestionably, there are, as you cited, Chairman, huge economic implications with over $504 billion lost as a result of the epidemic. That has a significant impact on local communities in terms of lost wages and productivity and the ability to continue to grow the economy. So I think it's really critically important that we design our interventions around trying to address some of those factors.
I probably have a little bit more boots on the ground perspective than most everyone here, but I can tell you that we've had to turn away work because we have open positions that we can't fill because in some instances we've had issues with people not being able to pass a drug test. Right now, the economy's in a great spot. We're essentially at full employment with some personal exceptions, but the folks that we're looking at right now to try and hire, a large percentage of those people have issues with addiction of some sort. And in our industry, we just can't employ them for a variety of issues, primarily safety.
I'd probably chime in on Sean and just take this into the different sectors. I know we're looking at manufacturing, that type of industry, but we have a critical job shortage, not unlike everybody else. But we're seeing all the industries having the same, just what Sean said, it's in all our high demand occupations, it's in all our major industries in the county, and it's really affected. And Sean, I'm glad you said it, because he's not the only company. We're actually turning down work because they can't fill the slots. And in a county with 75,000 people, that's a big deal. So, yeah, it's an issue, big time.
Just a comment from the 6-county region. it's going to be an ever greater problem. We have an aging workforce. One of the members from our Workforce Development Board gave a report last month that we have 25% of our trades people going to be retiring in the next 5 years, so it's going to be compounded by trying to replace those positions.
And to the county's point, in a $44 million budget, our biggest general fund hit is our county jail. And to talk to our warden, he says possibly up to 80% of the folks over there are in because of drug and alcohol related issues. So to the tune of $3.3 million, if you take that 70% out of there, there'd be a lot of money in the county that we could spend toward economic development or other issues that would help us along in the future.
Let me ask a question about what you're seeing. Really, it's for Dennis, it's for Stephen. And anybody else can chime in too. Tim, maybe you've seen this. Employers that are responding to this situation of A, having difficulty with recruiting, B, having employees who flunk a drug test, companies that are taking some kind of initiative to get their employees into a treatment program, whether it's bringing somebody in who can help manage the health at the company. You know, it's going to be very difficult for smaller employers to have that kind of expense. But as we look for ways to work through the shortage, but also what I talk about, getting people back in the game again. You know, lives that are being marginalized, lives that folks are checking out where we need them. We need folks in the game. It helps them, it helps us. Do you see any efforts on the part of employers to meet this head on, to have a more interventional kind of approach with employees who might be at risk? Anything out there?
Well,
now you have a situation, you can't have folks driving trucks and you got safety issues.
we do, but you have two challenges. You have the folks that are in the workforce, then you have your current workforce. So the people that you're trying to hire, if they would fail a drug test, then a lot of times there's not a lot that you can do. However, we're at a crisis right now as far as the shortage of available employees. We are working with programs that are helping addicts get back in the game. We are doing that. It is significant risk to us, but it's the right thing to do. We're trying to get them back to work. I don't think that anyone in this room could walk around with their eyes open and not say that you don't know somebody who has an issue. So we're trying to get these folks back to work, but there are resources available. Something as simple as a program called an EAP, Employee Assistance Program. It's a program that even a small company can contract with to get help to employees and their families, to allow them to get treatment, hopefully to get off these things and then get back to work.
This is for the group. Are there other ideas or questions about defining the problem that we should discuss before we move on to solutions?
I think the problem is not necessarily those people that are just addicted, but it's the impact economically on the families of those with substance abuse disorder. I've been in some settings where the use of the word addict is viewed as a word that is labeling a person versus it being a person that has a substance abuse disorder. And as you look at some of the ways, some of the grants and things that are being written, that's kind of the terminology that folks like to use, much like saying someone has an addiction to alcohol versus they're an alcoholic in recovery. There's some fine sensitivities, but the stigmatization of a person who once was addicted or was an addict, that stigma can go away if they get through it. It shouldn't carry or follow them through life. It shouldn't follow their families through life. To define the problem a little bit further, the economic effect of the ability for a family dysfunction when someone in their family is addicted or going through an addiction, not yet overdosed, or in recovery or post-recovery. Many of the deaths are in the period after rehab, after recovery, when they reemerge into the community, and potentially their liver and other parts of their system has gotten used to one dose of a drug. Now they've not been on it for 8 or 10 weeks. They go back to the same environment and take that one next hit, and they die. In Lancaster County, 2 of the doctors at the hospital. So it's all economic groups. The problem needs to be really clear that this is not a poor people's problem. It's not a rural problem. The child of our neurosurgeon and the child of our plastic surgeon, ostensibly 2 of the most equipped in town to be able to handle it, both of them lost daughters the day they came home from rehab. This is in the last 6 months. And so recognize the problems across all aspects of the community. I think there's a gap from a problem standpoint, if I could be so bold to suggest something, is it's one thing, we have trouble at the hospital with the same problem with our hiring appropriate people, not having enough staff. We're bringing them in from other counties. They commute them, we put them in a hotel to staff our little rural hospital. We're talking from nursing or lab tech or even doctors to get folks to come and be working there. But the other place that it's missing is a sober, supportive job opportunity for someone who comes out of addiction treatment. And just for the record, if any of you go to New Orleans, my background has been involved with disaster management after 9/11, after Hurricane Katrina, and these were like massive disasters where Congress stepped up and did millions or billions of dollars. And I'm realizing that as I moved to little rural Huntington, it's a slow motion disaster with this opioid and economic collapse of some of our environment that all feeds into it. In New Orleans, there's a model called Cafe Reconcile, which is a sheltered workshop for kids and adults that didn't get their GED or are coming out of prison or coming out of addiction. And on the first floor is a restaurant. On the second floor is a dormitory, sober dormitory, supervised. The third floor is a classroom. And these students, young adults, come through in 12 weeks. They learn 6 different job skills. They get their GED. They get placed. They get counseling. And it's kind of a re-emergent thing. So as one talks about the problem, there's a lack of opportunities for someone who's been labeled as an addict or has been addicted. And now they're stuck hanging out with the same old friends and the same old issues and the same old house and the same old poverty or wealth that they were once in. So a problem is job opportunities for those with addiction or coming out of rehab. Would be something else I'd love to add to the problem list. Sir.
Sort of echoing those thoughts, some of the things that we at ARC have observed and recognized as a problem generally relative to economic development, and one of the things that we have seen over the 50 years that ARC has been in existence was the average educational level coming up in Appalachia, slowly but surely. But we now have young people in high school because of problems at home are struggling to complete high school that shouldn't. We have, frankly, some problems of homelessness amongst high school students in some parts of Appalachia. Those are challenges. If you can't get them through high school, you have a hard time getting them into a vocational school or into a university. So that is a challenge. We now have more children being raised by their grandparents than at any other time in history. And that is a challenge to people who had not planned their lives that way and who may not be well equipped to actually do those things when they themselves are in their 60s or 70s. So the challenges are broad. This is a widely impacting crisis.
If I might, I would also add that one of the things that we've observed at the Economic Development Administration is that not all areas of the country are, frankly, equally equipped to deal with the crisis. They don't have the medical facilities in place. They don't have the trained healthcare workforce in place. They may lack basic infrastructure to support things like telemedicine and broadband access. These are kind of critically important building blocks. So as we're defining the problem, I mean, we need to look at some of those foundational issues as well.
Now let's move to how we can work to address these barriers to economic growth. Mr. Oldham, ideally, we not only want to ensure treatment is available, but also bridge the gap to employment. Can you talk about Operation Hope Shot and how it works?
Yeah. Yeah, I'd be happy to. In fact, I will say we actually have renamed it Recovery to Work. Kind of gave it a little, but it started with, as those things do, a conversation, concern, and really, realistically, it started with a conversation with one gentleman who was a counselor at Twin Lakes Center, which is a phenomenal treatment center in Somerset County. They really are doing amazing work. I know directors behind me. Conversation was, he walked in and this gentleman was a recovered addict himself, and he talked about he was a Naval Academy attendee. He was as an MBA, and basically one day wakes up in a state of disarray and no job, no future. And he really hit the ball, just really hit it right. And it's like, what can we do to get them, to make this work? Look where I'm at now. But somebody took the chance. So through that conversation, we got together as a team, and through Twin Lakes Center, the Career Link, and in both cases, we really, truly have a great Career Link, and likewise with Twin Lakes Center, and then, of course, myself as the Chamber. We sat down, we developed a program that really looked at how do we get them back into work. First and foremost, a person, and you're right, there's a stigma. And, no disrespect to jobs, but, if the best you're going to face is somebody's going to put you in a low-end job in a low-end place, you're not going to recover. You're going to go back to what makes you feel good, even if it's 5 minutes, because you're not going to make it. We found out, of course, we have the labor shortage. We have shortage in every industry. So it fits everyone. Somebody's got to find something. Not everybody's going to be in manufacturing. Not everybody's going to be in healthcare or hospitality tourism, which is a big industry here. So we put the program together, Twin Lakes being the beginning. This is where they have to prove that they're going through the process, that they're attending, that they're fulfilling the mission of recovery. We met with some of the area businesses, Sean being one, and talked about how would you fit into this. And again, they're looking for employment, they're looking for staff. So we started the process that way. And what we did notice initially is some of the applicants, it wasn't a lack of education, it wasn't a lack of skills, it was just they fell at bad times, all had their same story. These were some pretty well-educated people, and again, a plethora of everything, and don't get me wrong. Thus, we bring CareerLink into the equation, and CareerLink was the next step because now we connect them with the employment, we connect them with jobs, training, and education, because again, they have to fulfill a certain area of work. They might have a degree, but they don't have any. They need some education in welding or some type of technology. So the Career Link, and then lastly, the Chamber's role was basically promoting, talking, kind of being that interim between the businesses and the other two partners. It's relatively new. I can say it's shown success. It's too new to say it's perfectly successful, but it made sense. It really made sense to get these people. You've got to give back their self-esteem. And again, think about the job that you're giving them or they're open to. That's why, again, I say that if you feel good for 5 minutes, it's at least you got something. But so we're pretty optimistic about it. We're actually going to do a presentation with and help me rural PA. Very dang. Center for Rural, yeah, we're actually doing up there. And then other partners come on. Of course, Twin Lakes is supported by the hospital. So we've kind of got a community effort. Commissioner's been on board. Everybody has come in on it, including my legislators. So at this point, we're underway. And probably the most important thing we can do is we've got the team together, that's not a problem. Funding at some point, because we actually talked, we have a workforce education program which kind of fits into this, because we've already discussed bringing some of our workforce education panelists, that type of thing, taking them out to the treatment center so we can actually kind of encourage them, as most people do. They don't understand industries either. So we're really looking at the kind of blending the models together. Danny, question?
Sure. If I can make a quick comment on that. And so as we're moving forward, if we look at how to make this program even better, two of the biggest things that come up anytime we're talking about folks in recovery is transportation and housing. Those are huge issues in Somerset County for folks looking to rebuild their lives. So in order to make this program succeed, we really have to look hard at the transportation and housing issues.
Senator Stefano again. I just want to tell a personal story to back up your program on the chamber. And it's just yesterday, ran into an old friend whose son is about late 20s, early 30s, who is a heroin addict and in recovery, and took the CDL classes, graduated top of his class, and is now fully employed as a truck driver. And he said that is the key for his recovery. Now he has something to focus on. Now he has economic development. He has a paycheck. And now he can focus on bringing his life back together again. And that is so important. It's connecting our industries to those in recovery. And in his case, it's working. It's working wonderfully. His mother was just ecstatic that he's got to turn his life around. One thing I did learn, and I'm sure most of you know, but I won't share it again, that he is in recovery. And as if you talk to any of the addicts, there is nothing after that. You are always in recovery. You don't ever become recovered. This is something that he will face for the rest of his life, but he stays gainfully employed. He knows he can focus on the right things in his life.
Mr. Chairman, I would like to commend this community, because by establishing this partnership between the Chamber and the economic development folks, the employers, and the treatment facilities, you're ahead of most communities. And I encourage you, and I am in fact encouraged by you, so I commend you for this collaborative approach. We think there are things going on here that can be shared more broadly as we talk to other communities. And you're absolutely right about the importance of the job, not only to the employers, but to the individual. You know, statistics show that most folks, as they go through the recovery process, have multiple relapses. But what we have seen is the single most common thread of someone that has a successful addiction recovery outcome is gainful employment, and that sense of self-esteem and self-worth that it instills, and that daily exposure to a network of positive influences. So it is a win-win for the employer, for the individual, and for the community. So you all are doing something right and are ahead of a lot of folks in what you're doing.
I just want to make a point that it ties into the legislation that Chairman Barletta introduced, the Treating Barriers to Prosperity Act, and the importance of flexibility in our federal programs, because people here in Somerset County know a lot better than folks in Washington, D.C. how things can be made more effective. And the key for us is to make sure that the legislation is as flexible as possible. As I mentioned before, we had over 70 pieces of legislation go through. And if we need to take a closer look at any of them to make sure there's the flexibility that's going to help out communities like Somerset County, we want to do that. A bill we recently had, the Thrive Act, my colleague Congressman Barr, 5735, the Transitional Housing for Recovery in Viable Environments. It's a demonstration proposal that would allocate a portion of housing choice vouchers to transitional housing, dealing with this cohort of folks who are coming through addiction treatment, to the issue of housing. We look at things, drug courts, veterans courts, diversionary programs that we can try to head somebody off at the pass. critical programs. I know I had legislation that went through recently called the Regroup Act that reauthorizes some of these Department of Justice programs and actually triples the funding for them. And again, giving states and localities that flexibility where they know best how to handle the problem. So as we continue this work, if particularly those in local elected office see a program that you're wondering if this can be retooled to make it more efficient, we need to hear about that.
And I thank you for that, because I know Representative Metzger and Senator Stefano have both heard me say oftentimes that as you allocate money to this problem, you know, we do have a pretty good idea where we need to spend it. And if we come to you guys and throw out an idea that you think, that just seems nuts, just take a minute and think about it, because you know, we would appreciate that flexibility when it comes to that money, because there is programs that we would like to spend more on, but if our hands are tied, it's a tough job to do.
Just what you mentioned, Mr. Rothfuss, a program that we started here as a pilot program of getting individuals in the appropriate setting, working with law enforcement through our emergency department, and those individuals coming in, if appropriate, are offered rehabilitation, a warm handoff, and get them into treatment versus incarceration. I think the Attorney General has supported it, but again, it comes down to access for those individuals. The frequency coming through our emergency room is staggering in a small location, but getting those individuals the appropriate care, I think is critical too, and I think it's more meaningful and a better outcome for that individual versus incarceration at times.
I love the term flexibility. It made me sit here and think about how, in a short period, how flexible this has become. Commissioner mentioned transportation. Our Curling sits a few miles outside of Somerset. Most of the bulk people live there. So what we do, we brought CareerLink to the treatment center. Now they will come out there instead of vice versa. But we made that easier. One of the other areas we've looked at, I can't say we've done this. First off, this program was highly supported by the judges and the DA. Is looking at, a lot of these people come out with significant fines. They've been in the criminal system somewhere for whatever reason, petty or larger. They're faced with fines that are pretty significant. Now I got to give them transportation. They got the job. How do I get them there? Well, I've got $5,000 worth of fines. I'm not buying a car. So we actually are looking at, is it smarter to reduce, or even through an earned system, get those fines taken care of or reduced based on a merit system? Because that seems to be money better spent or not spent in some sense. So we're still on a learning curve too. We're looking at the program and trying to fit it better. Again, CareerLink was so easily saying, we'll just go out there. Yeah, that solved the problem right away. They found ways to get to their treatment, but a little tougher to get to CareerLink, I mean, in their mind. So, and I agree totally with programs. It's not disrespect that sometimes money's put out there, but there's certain criteria tied around it. Let the money fit the programs than vice versa, because you know, I don't know if this one would come out, if the government released money, is it's going to come out this specific that my program fits, or our program, I can take it back, or are you going to put money out and say, this is what you have to do with it? No, that fits. So again, I agree with my colleagues.
The comments made are right on target. Speaking as a small community with limited capacity, most of the smaller communities with limited capacity and limited healthcare systems do not have grant writers, do not have grant managers. And by the time certain grants hit our awareness, or funds or programs that are available, there's a week or 5 weeks or 8 weeks of which to rapidly respond in a way that makes it near impossible. One has to drop their normal jobs to make a grant happen. And then secondarily, if one, in my community, it's clear, they're not skilled in how to best bring in the money. And they're overwhelmed with, let's just take a project we're working on right now in Huntington, where we have folks that are unemployed or underemployed because they're coming out of treatment. We have a blighted downtown with buildings that could be had for $50,000 or $100,000 that are going into disrepair. We have people that need job opportunity, and we have a career and technology center that's willing to shelter them and teach them the trades and mentor them and get them geared up to eventually work at a place like Riggs Industry at a more professional level. It involves workforce grants or housing grants or adaptive reuse grants to meet the certain compliances of if we redo the building, we need an elevator, et cetera. And between the various agencies, a suggestion would be is a one point of contact for a community to access the programs that might be available on a flexible basis, or at least a consultation to help us get there. As we collaborate in the communities, could I encourage more collaboration amongst the various silos of the agencies of no, this is workforce, no, this is transportation, or this is, God forbid, broadband. Broadband is on top of everything here, guys, respectfully. We cannot get our patients the warm handoff you're referring to beyond just a couple dozen people, because if we give them their iPad or cell phone, I do telemedicine type things, and the client's at home, the person with the addiction or their family, for them to talk to the counselor, if we're lucky enough to have one, they don't have broadband or even a cell tower. So it's not just telemedicine from my hospital, let's say, to the drug treatment center, but it's from that person to their counselor, or that person even to their mentor who is a recovering addict. So broadband is key, not just to workforce and education, but it's key to being able to do healthcare in a way that will keep them from coming to the ER and spending an absolute fortune tying up the resources of that ER and having everyone else wait. Just another aspect of the ER, just to get the point on the table, and I realize it's a little out of sequence because it's part of the problem. I want the leadership here to realize 1/3 of our chronically ill patients are addicted. So when we look at treatment of congestive heart failure and reruns to the ER, or frequent utilizers for emphysema or diabetes or asthma or mental health issues, 1/3 of them have a comorbidity of addiction. So it's affecting all health care
would you have any
costs.
similar situations here?
Yeah, those numbers are, by the way, those are numbers analyzed by Deputy Secretary of Health, Dr. Lauren Hughes at Pennsylvania Department of Health, as they are looking at our hospital as a rural health transformation global payment pilot project. They analyzed all of our numbers and all of our issues. And we actually were shocked. We didn't realize it was that. It just seemed that way. But 1/3 of our most costly 1,000 patients have a comorbidity. So this is affecting all healthcare costs across all sectors, across all insurance companies, not just being a government issue.
I wanted to add something else. Another program would be a total answer, but it would help some. We were awarded a power grant from the first round from ARC to establish what we're calling an entrepreneurial ecosystem that covers Blair, Camden, and Somerset counties. And we have a coach in each of those counties that works with entrepreneurs to steer them wherever they need to go to get.
What was the amount of the grant, Steve?
I think it was approximately $1.9 million.
Give us.
So, one of our coaches in particular, Jose Terry, was a former staff of yours, has been going into the prisons as well as housing projects, talking to these people about entrepreneurship, and that is another area where maybe they're not able to get a job with the company, but if they start their own business, they're going to be able to have something that can give them the esteem that they need to be successful and not relapse. So.
Real quick, it works. Our coach here, Dan Parisi, there's a coffee shop on Main Street, or actually North Center Avenue, and they were both recovered addicts. Basically a year later, it's still going. I mean, we're hoping for the best, but I mean, there's a perfect example, and that was absolutely part of that program Steve just said.
Mr. Thomas, I know ARC has begun focusing on attracting healthcare businesses, on how attracting healthcare businesses can not only help create jobs, but also improve access to treatment. Can you explain?
Mr. Chairman, relative to the problem of opioids, Appalachia does have a shortage of qualified healthcare workers relative to substance abuse counselors and mental health counselors. We are actively trying to see what ARC can do, working with our local partners and local communities to help alleviate that. Some of it's going to require education, and this is a problem/opportunity. There will be career paths for people who are interested in helping with this problem. And community colleges and universities are also stepping up and expanding their programs to be able to produce more substance abuse counselors and mental health professionals. We have been involved with that. We have helped community colleges and continue to help schools establish those kind of programs. We are also working to help expand broadband in the region. As has been mentioned here more than once, it is key. It is key to medicine. It is key to rural health. So that is something that we are actively and will continue to invest in broadband to try to help expand not only healthcare generally, but also with a focus on addiction.
Dr. Gilio, I know you've done a lot of work examining how the availability of broadband can impact our ability to attract healthcare businesses. Can you talk about your experience with the need for broadband?
You know, I am thinking of after Katrina, there was a massive problem with post-traumatic stress syndrome. And folks, there was an increase in suicide, there was an increase in death from chronic diseases. People just stopped taking their blood pressure medicines, etc. There was not enough healthcare providers. So we, through a federal exemption, were able to cross state boundaries and do telemedicine across the country. And we had counselors from across the country doing telemedicine consultations for mental health issues for folks that needed it in the greater New Orleans or Louisiana area. But there, in a natural disaster, you can break the rules a little bit. There's exceptions that make it easier. I'd really like to encourage folks to be thinking of this as a national disaster, and whatever exceptions need to be made with certain policies to help with the flexibilities and localized funding. This was very appropriately suggested. We can cut $5 million out of our costs by Dr. Hughes' analysis with congestive heart failure telemedicine monitoring. Something as simple as sending someone home with a bathroom scale, a Bluetooth-enabled telephone, a pulse oximeter, and a daily check-in call. And if they gain more than so much, or their oxygen goes down a certain little bit, we can intervene and reduce that trip to the ER. It's been shown at UPMC and Oshner Clinic and other places around the country. It's a $1 billion industry right now with telemedicine monitoring. Best Buy is wanting to do a demonstration project with their Geek Squad, and their aisle number 3, their most profitable area of their stores is telehealth and telefitness, or e-wellness. They have different names for it. And I've been in conversation with them about why not invest in something like the opioid crisis and have their Geek Squad be able to help people get their phones working to be able to connect with their doctor, with their local regional hospital, say like Somerset, within the regional, like Western Psych or whatever. So I guess what I'm saying to you is the experience with telehealth is big business now, especially in cardiology, because of something with the economics of the healthcare system is key. Healthcare system doesn't pay well for mental health. It really doesn't. It's hard to get people to go in psychiatry, psychology. It's much easier to get them to be invasive cardiologists or heart surgeons. And it becomes very expensive when you care for heart care. And so as one looks at where can technology save money, they look at the most expensive. And industry has invested in the treatment of preventing the readmission of people with heart disease. The Medicare and Medicaid laws say 30-day bounce back. If you're in the hospital and you're discharged and you come back within 30 days, the hospital eats that cost. So the hospital is highly motivated to keep that person out of the hospital for at least 30 days. And the telemedicine becomes one way of giving better care, but it also is one way of stabilizing the economics of the hospital. We need to treat mental health with as much, mental health, when I say that, I refer to addiction as well. And given the comorbidities of all these other diseases, telehealth has been shown to be an economic driver for COPD and congestive heart failure, and I think it can be for opioids as well. And I think that the ability to be reimbursed for telemedicine at certain appropriate levels will make it more economically viable to be able to recruit more people to be substance abuse counselors. Substance abuse counselors now are paid about the same as a glorified nurse's aide in some settings. It is not a career path that gets you very far. At least you and your wife both have to be working to buy that second car and to raise your kids. So to treat, is one way as we're looking at this is to really raise the reimbursement, A, for mental health workers, but B, make some exceptions to allow the billables, at least short-term, for telehealth services immediately. And it will make something like the CEO of a local hospital, I don't know, he's not his head, he'd step up his services if he could bill for it, as opposed to running it away, and it's a cost center for him right now to keep his ER empty, so he can treat other patients or not have other patients wait. So it's a multi-billion-dollar industry, and it's ignoring mental health because of the reimbursements. Thanks for asking.
Sure. Mr. Alford, Dr. Gilliam noted it would be helpful to have a one-stop shop for federal programs. I know EPA has done some work to try and streamline coordination at federal level. Can you talk about EDA's role in that regard?
Absolutely. And I'm glad you brought that up because I was chomping at the bit to comment about that. I think that EDA does have something that can be helpful here. Over the last several years, EDA has been rolling out a new business practice within the agency, and that practice is focused on enhanced coordination among our federal economic development partners to achieve greater economic development outcomes, where through what we're calling the economic development integration business practice, we can work with a local community. And I want to emphasize that in everything we do at EDA, we're very much about bottom-up grassroots approach. We fully recognize that it's the communities themselves that are cognizant of their problems and aware of what they need to help to address those issues. And so in pulling together this business practice, what we've tried to do is to identify communities that have a pressing economic development need or challenge, and then have EDA serve as the convener where we can pull together other federal agencies that may have complementary assistance or assistance that may fall outside of what we provide, but that will be very helpful in addressing a community's need. And we've been holding things called regional economic development for regional economic diversification summits around the country. And those have been occasions where a community has identified a pressing need. We might pull in other federal agencies, USDA, Housing and Urban Development, other agencies within commerce to, in a coordinated fashion, address those needs. So I think that there is a good convening role that the federal government can play in bringing the right players to the table to address those needs, whatever they might be.
Keith, I don't know if you were...
I just want to touch base with Mr. Thomas here. You know, I know ARC has already been issuing some grants and taking other steps to support efforts related to the opioid problem. And just trying to get a feel for what's working, what's not. As you kind of fly up at 10,000 feet and see different communities responding in different ways, how are they using the resources that you're able to deliver, and what should we be doing more of, and what should we be a little bit skeptical of?
I would say, generally speaking, the communities that have been most successful in making making some headway, and we're still, at the early stages of this fight, I'm reluctant to say. But the communities that show collaborative effort across all sectors, much as we're seeing here in Somerset, communities that have some leadership, and it may be one person in the community, it's a spark plug, or it may be multiple people in the community, but that seems to make a lot of difference. And these spark plugs, as I call them, are very good at seeing the opportunities across, whether it's an ARC opportunity or an EDA opportunity or a USDA, rural development opportunity. They are very good at seeing what's out there, identifying those, and bringing those resources to bear in their communities. We're seeing some very promising signs in some communities in West Virginia that we have assisted, and frankly, some communities that are the poster child of opioid addiction. Williamson, the community of Williamson in Mingo County, very early on, but we're seeing some things that look promising because people realize the extent of the problem and that they're going to have to do some things locally and have some grassroots ideas. One of the things that we think is a collaborative and comprehensive approach are those that involve social enterprises, those that can help match up someone who completes a treatment program with a job. The social enterprise is connected to and is a part of the treatment facility. They may have a landscaping service, they may have a coffee house, but they put those folks in those jobs, and admittedly sometimes they're starter jobs. But you have folks that have to relearn some soft skills sometimes and have to take little steps before they take the big step. So
Are you documenting those and publishing them for other?
We are beginning to develop some studies to be able to share as to what works and what doesn't. And that is one of the things that ARC does as a convener. We take people across the region, communities across the region that have some things in common and some differences, and we are able to allow them to share things that work and also things that they've tried that didn't work, so that they can help other communities shortcut and maybe not go down the same dead end. So we are very much, and that's one of the things that I'm looking at, having been in the position about 4 months, is trying to compare about 3 or 4 community models that show promise, and then after a period of appropriate time, actually being able to do a look back and say, okay, which of these has really worked, or which aspects of these different approaches have really worked.
And I don't know how close you've been looking at Chairman Barletta's bill, the Treating Barriers to Prosperity Act, and just the express authorizations that are in there that would allow the Appalachian Regional Commission to clearly be engaged in a number of these areas.
We look at it very closely. We consulted with staff, and it certainly aligns with what we want to do. And frankly, we're going to take it, even though it hasn't passed the Senate, we're going to kind of take it as a very strong suggestion as the role that is expected of ARC.
Not very much passes the Senate, by the way, just to add to that.
We very
No, you have to comment on this.
We very much are cognizant of it and think that they're the right things to do, and so that's going to be part of the initiative at ARC.
And this is for the group. Are there other ideas or questions on potential solutions that we should discuss that we haven't?
Yeah, if we can, maybe Andy and Sean being employers of significant number of folks in Somerset County, maybe touch on that a little bit as you look at workforce, as you look at fulfilling the needs that you have. And there's also an issue broader, just culturally, and it's retaining folks in rural areas generally, because there's that element of things. But what's working for you as an employer, a significant employer in Somerset County that we should be looking at?
Well, I think our role from the hospital perspective is Twin Lakes. We have a project ongoing now through the RCAP grant, and certainly looking for more funding. Is to expand beds, access for treatment, and ultimately the downstream effect of that is helping our local employers. It seems to be getting worse. I agree with Mr. Thomas that I think we are ahead of the game, but we're small. But it comes down to resources, reimbursement, access for those individuals needing help. I think all the ideas that everybody around the table have mentioned today are outstanding. We're trying to address all of those, but truly it comes down to funding and having the means to build more facilities, recruit more staff and talented counselors. Tremendous shortage, tremendous turnover because of their wages. Physician shortages. Those physicians that can, appropriately provide medically assisted treatment. There's just not that many out there. So we have a part-time physician trying to address a facility that's 100% capacity.
More resources are being made available. I know another $1 billion with a B is going to be released this September. This is record levels of funding coming out of the federal government. Obviously, there needs to be more if we're going to really get to the point where we need to be, but we are making more resources available, and certainly we'd be happy to kind of itemize what's going to be out there.
So, as a healthcare provider, I think we are helping all the businesses by our mission to help these individuals with addiction. I know one thing that hasn't been mentioned is I think we do a tremendous job with our staff and Brooke and the physician of preventative means. We're in almost every school in the region. We're expanding to other counties. I personally think we have to stay in elementary schools, high schools, educating them on the dangers, prescription medicines at home, their grandparents, their cabinets. I mean, it goes on, but I think there has to be some funding for prevention as well, and not just address the acute epidemic that we're in right now. I know we want to address that, but I think down the road we have to protect our children and enhance that as well. So I think we're doing a good job of it, but again, every day we're all affected by somebody we love or know. So I think more funding towards prevention.
I think you touched on a good point, because our committee is very involved in pre-disaster mitigation, where every $1 that we spend before save the taxpayers $6 to $8 on the back end, and we don't look at the opioid crisis in the same way as we look at a disaster, flooding and other disasters. But there's so much to be said about prevention. Spending the money, and it's hard to get Congress to do that, to take money that it doesn't have and put it up front without being able to tell people how much money you're saving, but we know that actually works.
Yeah, I think it does. Certainly the SAD program, years back. I hope it has a positive effect. I work very closely with the school districts in our region, and you talk to superintendents, and they tell you about kids coming to them not for their own addiction issues, but mom and dad are having drug issues, and no food at home. I have a sibling. So you hear these personal stories, but I think it's important that we're in those schools on a regular basis. So we're trying.
I agree 100% with Andy. In fact, you said something, and I was hoping to hear this entire time. I've heard nothing about personal accountability. How do we prevent people from getting into these situations in the first place, and how do we educate people? I'm old enough to remember the commercials with the egg in the frying pan. You knew it was bad for you. Where is that message now in regard to opioids? But as far as what businesses are doing, I think they're doing a fairly good job, especially in this area. I mean, we know the risks, we know the people, we know the resources, and we need workers. So we will take chances when we can on a person by person basis, especially in a company like ours, with family owned. And we have had some success, but we have to stop the bleeding. There's people that have the issues now, but we can't keep adding to that list. It's too great.
A couple points. I'll echo the talks about prevention, and I like the analogy. While we're diving into the pool, saving those from drowning, we still have to build a fence around the pool. So we need to keep that in mind as we work on prevention. And as a member here in Somerset County Drug-Free Communities, that's what we're doing. We have drug prevention programs in all the schools, and it doesn't address drugs per se. It addresses the forces that drive addiction, which I think is, and our evidence shows us that we're leading in the right direction. But Mr. Rush brought up an interesting point about medical assisted treatment. We were talking about employment. Those that are employed are in better recovery. And that's something I'm working on in the Senate. My Senate Bill 1087 does address the disparity between urban and rural access to medical assisted treatment. So where there is areas of treatment available, that half hour for urban is also available, half hour in rural areas where available. So we can make sure there are facilities available for those who are in recovery to keep them employed, because the statistics show that those are on those types of treatment will stay employed.
Can I comment? We're kind of talking a little bit on the workforce education, and we're pretty proud of our program here. 11 school districts, everyone's fully engaged. Virtually, I don't think there's a business that's not engaged. Sean's a big very active on that. We're basically learning those people have no understanding of his industry and no understanding of even healthcare industry. Our program is really proactive in getting the students out there, but we also started with the educators and got them relevant to what Sean's industry is all about, or again, any of the industries in the county. We actually can show some success. Our tech center is probably showing the highest enrollment it's had in maybe a decade. We're seeing more cooperative students going into industries, working while they're in the seniors in high school. But I think most importantly, and I think even the educators had aha moments when they walked into any of the industries, they had no concept. So we know this parents don't, we know the students don't. We've been really good, and again, I can't tout enough that the education system and the work and the employment system, I mean the businesses are working collaboratively. That's a big deal, because nobody knows what's behind those walls until somebody shows them. So I think that's a beginning. Show them a good job in the industry, and you might, again, if we save one, it's well worth it.
Just to add briefly, we have a program called the Force for Health in Huntington that has also been used in Northeast Ohio. We're in 30 counties, over 100 school districts, and we have the Force for Health program is not necessarily just a program to teach about the issues of the drugs, but it's taking a different concept. It's taking the concept of making an informed teenager the agent of change and stability in a dysfunctional family. Can they be a force for health for themselves first? You put on your oxygen mask first before you help the child next to you on the airplane, like they say. So can we empower a middle school or high school student with the assistance of people like kids at Juniata College or AmeriCorps workers to be a force for health, to learn it, live it, share it, learn how to make healthy decisions about what food they might want to buy, getting more exercise, how to get transportation taken care of for their grandparents' hypertension or to get to a drug counselor, how to deal with the housing issues they're dealing with, etc. Addressing really the social determinants or influencers of health is what we call it in public health. The housing, the connectivity, the transportation, food security and such. And the teenagers become trained to become agents of change, to create a culture of wellness, a culture of health, a culture of support in their schools. But also, we're using it in the Rotary Club, the churches, and in some workplaces. We're just starting. We're way behind where you guys are here. I really commend you. But that Force for Health program is online with a membership for people, with a membership then to create a team. The team identifies a local project, and that local project becomes something that we help enable. It's called an idea on a hyper-local basis. The team, with mentorship from people like us, identifies a problem, designs a local solution, puts it, affects it in place, and then assesses, did it work or did it not work, and then tries to share it. Good success in Ohio. We're just getting it started in Huntington. I'm glad to share access to or more information about it with anyone from this region and see what I can learn from this region for what we can take back home. But the Force for Health program, I think, could be an asset that could be scaled nationally or regionally or nationally.
Yeah, I'd like to make a couple of extra comments as to what actually works and data actually exists to support. When I came on board as federal co-chair, that was one of the first endeavors I started, was to let's see what data is out there. And there's not a lot of data out there. And we got to the point where we actually contacted the RAND Corporation, which is nationally renowned as research. And they told us, quite frankly, that at this point, the data does not exist to say something is a best practice. There are promising practices, but we are not far enough along, and given the nature of the problem, the way that there are repeated relapses in people that suffer from addiction, the data has just not been developed yet or made evident. It's not to say that it won't be, but it's just not there yet. So that is not good news, but there is better news in that there are some communities that are doing better than you would think they should. If you will look at the maps of the counties in Appalachia that are the most economically distressed, and then compare those with the maps and the charts of the counties that have the highest addiction and overdose problems, they're almost the same map. So there is some connection between economic development and addiction. I won't say which causes the other, we don't know, but there's clearly some correlation. But ARC recently released the results of a study that we had commissioned called the Bright Spots Study, which surveyed a number of communities across Appalachia that the data showed they had better health outcomes than you would expect. Not to say they had great health outcomes, but for their resources, they had better outcomes than you would expect. These were relatively poor counties sometimes, didn't have a lot of resources. But one of the counties that we looked at and considered to be a bright spot is actually Potter County in Pennsylvania. And where we learned that the local hospital, law enforcement, and the school system and other leaders were working to develop community-based interventions to the opioid crisis. This community engagement, some sense of community support, seems to have some difference that's being reflected in outcomes. We have poor communities with not great outcomes, but the outcomes are better than what their resources would make you think they should be. So there is hope out there. And we are working to identify those communities. There can be models. ARC will be working to develop data as it becomes available. But that's just the nature of the problem at this point. So I thought I would share that.
Thanks, Chairman. I'd love to piggyback off that a little bit and talking about solutions. EDA is definitely not a first responder to the opioid crisis, but I think that we can be very helpful in creating the conditions that allow an area to recover. We've had a lot of discussion here today about one aspect of the solution is that people need to be able to move into meaningful jobs upon recovery. And EDA is in a position our very mission is to help create the conditions that allow for growth and economic development in economically distressed areas and regions. And we have a variety of tools and programs that can assist with that. Really, one of the cornerstones of the EDA's efforts, which I think is something that all communities can learn from, is good planning. We've talked about being proactive and taking a mitigative approach. EDA requires something called a comprehensive economic development strategy. And like ARC, we support a network of economic development districts that help to create these strategies for areas. I mean, these strategies should account for the challenges that are confronted in those regions. And if the opioid crisis is one of the major challenges, then the strategies should be developing mitigations to address that specifically. And those might take a variety of different forms. You know, it might be that you need to support growth and development in the healthcare industry. You may need more healthcare facilities. You know, EDA and ARC have grants that can support those things. It might mean that you need to improve your healthcare workforce. Again, we have grants that can help with workforce development in that area. And then when people are treated and re-entering society, they have to have meaningful, you know, higher skill, higher wage jobs that they can move into in order to sustain those gains. And again, you know, EDA has grants that can support public works investments, strategies, technical assistance that can help these areas to recover and grow their economy. So I think one of the solutions as we're talking about opioids and economic development is to take advantage of the existing economic development programs to build those foundations for success.
I'd like to move on to the role of the federal programs. It's important for the Congressman and I to hear your opinions. To the non-federal participants, with ARC and EDA having limited funding, how do you believe their resources should be targeted? Need Jeopardy music behind this thing.
This is probably a little outside of that scope, but the thing that we haven't talked about, getting to workforce, and it is related, is that we have jobs, we're lacking trained people, and in a lot of instances, we're also lacking people. The ability to attract folks from outside the region to here. One of the statistics that families are going to look at would be the crime in an area. Fortunately, in Somerset, that hasn't been a problem. Not everyone who works in Somerset lives in Somerset, myself included. I'm from Cambria. There's a problem there, and it makes it even more difficult for employers, especially regional employers, to attract people from outside the area if the region is perceived to have a drug issue. So I think one of the rules of state and federal government is certainly law enforcement to get control of this.
I guess I would say that one of the first things that we would see is that, and I think there's consensus around the table, that the flexibility and innovation of how we apply programs and funding is one of the things we can all agree on, and it's a change that needs to occur. And that's why I thank you, Mr. Chairman, your bill treating Barriers to Prosperity Act, I think really hits on how we need to change our approach. And I think that will make a tremendous difference from our standpoint of how we apply the funds and how we can get the funds out and deploy them in a way that, you know, I think one of the things that Sean and Andy have talked about is that, you know, the true driver here is the need and necessity of the workforce. And if we can allow them, uncuff them and say, hey, the federal government, from our programmatic or regulatory standpoint, would leave them alone. You know, if we could pull back from our EPA or MSHAs or whatever, leave them be, create more jobs, and then deploy the money the way that your bill envisions, I think it would make a tremendous difference here. We would have more jobs. That would force our employers to be even more innovative, and then we come up with better collaborative programs across the board. But you know, your bill and your formula, I think, is a great step forward for us.
And I guess I'd like to say too that as Tim and Dennis both realize, there is a broadband expansion going on right now in Somerset County. We're not quite as far along as we hope to be at this point, but we're getting there very quickly. And I truly believe that is the right avenue to take, because it's going to help tremendously. We're not going to cover the whole county, but we're going to lay down a pipeline that can be used to reach out to different agencies. So I think that is one of the most important places, that we can see that we're using that money right now. And to a point that the senator touched on slightly, I'll say that Somerset County's drug-free communities, I know I co-chair that. And it's important to me because we bring so many different folks throughout the community. We have law enforcement, we have our legislators, we have Twin Lakes, SCA, just everyone comes together, and just the opportunity to sit down for an hour or two and discuss what's going on and where there's needs for money and who we can look to for that money. I think that's key. And drug-free communities, if I'm correct, I'm only a commissioner for 2.5 years, so I could be wrong here, but drug-free communities came about from a grant, and I don't know where that grant came from. But as we talk about spending money before we see results, that is a very good example of spending money on something that was probably a little outside of the box at that time. But I know myself and Senator Stefano, I hope he echoes this comment, that I'm pretty proud to sit on that drug-free communities because it does pull everyone together. And if nothing else, we can see where the greatest need is for us to spend our money, and then we're going to come to the ARC and the EDA to see if we can make it happen. So just a couple comments there.
Just to echo that, not only at the federal level but the state, any way you can encourage cooperation. Pennsylvania is known for our tons of municipalities and authorities and having all these barriers to working together. But this regional comprehensive plan that we completed was the first time that 6 counties ever went together in Pennsylvania to do something this collaborative. And it shows the leadership of the commissioners and the rest of our board to how they want to work together. They've also been working together on 911 related things, sharing of equipment, which helps cut down on the cost that each individual county had to pay out. The example of silos, Somerset obtained a grant to tie into one of the other 911 centers, but it's so rigid. There's only so many things you're allowed to do, and you can't do anything over and above that. But anytime there's a project, we should be looking at ways to, while the project's being done, whether it be the lowest amount of cost, how can we run extra fiber, make it available. There needs to be guidelines put in place to how that would be able to be used, but that's the time for those types of things to be taking place. We need to think more along those lines of how we can take advantage of the projects that are being invested in the communities and how we can further our bang for our buck.
Yeah, again, to our non-federal, I want to add something.
I hate to do it because I'm monopolizing the time here, but got opinions and we're listening, so I have so much respect for your patience with this. Just two things to think about from a limited focus standpoint. I'd like to give examples from perhaps other disciplines that have good evidence. And as these two gentlemen talked about being the conduit for a coordinated community, I'd like folks to look at something. The sociologist is Jeffrey Canada is his name. He put together something called the Harlem Children's Zones about 20 years ago after 9/11. And he found that as he was fixing up neighborhoods, if he got rid of the rats in one house, one building, they moved next door, whether we're talking about rodents or people in gangs that were doing violence and awful things. When he got the block together and got everyone on the block on the same page and said, here's the rules if you want to live on this block, renters and owners, we're going to approach this block a certain way. And we're going to have this block where we are supportive of our children. We walk them to school. And as the gentleman was talking about a drug-free community, picture a drug-free block. Or picture a block that has economic development. I would love, as you're looking at that $1 billion, to have one of you guys come and look at the 700 block of downtown Huntington, where we have a 30,000 square foot store for sale for $150,000. It needs $2 million worth of renovation, but it was the anchor of downtown, which is crumbling. Taking the 700 block and turning that into 10 or 12 apartments, a couple stores, a couple cafes, doing it with people in a sheltered workshop environment, so to speak, as that first entry job and let them mature in their job capabilities. So Harlem Children's Zone example as a community then where you can collect the data. Because if you want to come to Huntington, I have all the data on our healthcare costs and on our services and what we get billed and what we get paid. And we're glad to share that in a de-identified way to find test what programs work or don't work. So set up test communities. Harlem Children's Zone would be one example. A second issue is you're looking at a potential focus of limited funding is to look at funding that's already been spent. And I'm referring to about $95 million for the statewide network called KINBER, K-I-N-B-E-R, kinber.org. It is a brilliant strategy of putting dark fiber for Internet 2 for universities throughout the state. It's shaped like a figure 8, goes through State College and Pittsburgh and Erie and Scranton and Wilkes-Barre and Philly, and half it's not being used. And I've been talking to them about what would it take to just buy 2 fibers to give me an 1,800-mile telehealth loop to make counseling and everything else much cheaper. And it's $1 million or $2 million is all it is. So when I'm trying to light up a series of valleys as they approach Millcross, Mount Union, and some of these other neighborhoods, where we're putting it then to a tower and beaming it down the ridges of our beautiful Allegheny Mountains, making it perfect for broadband distribution, using the tops of mountains as your towers to some extent. Very inexpensive ways of expanding broadband. There's a co-op in Mill Creek of a bunch of citizens trying to start their own little co-op tying into KINBER and raising the money to build 1 tower to light up 1 little neighborhood. And our goal is free internet for everyone at a very, very basic level. So they can register to vote, or change their driver's license, or do online banking, or even, God forbid, a job application. At a higher level, can we then do telehealth counseling for the higher level broadband? I think we really have to think about leveraging, as you look at one of your staffers, look at how we can leverage the KINBER investment to be a network for telehealth or for opioid resources for the state as a dedicated network for telehealth at much less cost than $1 billion. There's 2 ideas. Thanks for listening.
So again, to the non-federal participants, are you getting what you need in terms of technical assistance, information, and the sharing of potential solutions from ARC and EDA?
It's quiet, so I'll comment.
Okay.
I never heard of ARC or EDA until I took the job in Huntington. I lived in Lancaster. When I was put into the new role and I was told by the hospital, help, we're going under. We have to sell the hospital or we're going to close the doors September 2018. So we sold the hospital, but in the meantime, how do we support a crumbling downtown, attract the workforce to want to live in Huntington and have all of our young people move away? We have employment problems as well. We have wonderful jobs at Bonnie Ford, and we're talking, $70, $80, $100,000 a year types of jobs that we can't get the skilled workforce. They don't want to live there because of the schools. There's nothing to do downtown. The point I'm getting at is these guys are going out of their way. I show up at a meeting, and it's not just, you have leadership here, but their underlings on our local basis are at every meeting I've ever been at that deals with these topics. They show up, and their support has been tremendous. I've actually gotten phone calls and emails saying, please apply for this grant. All right, we just didn't have the capacity to do it. So I need to give feedback to you that they're doing a heck of a good job, at least on my level with my limited experience.
I just wanted to comment as far as ARC goes, it's been a major shot in the arm with the power funding. We've been able to tackle some larger projects that we wouldn't be able to do otherwise, such as the entrepreneurship ecosystem that I was talking about, the broadband project for Somerset County. We helped with that, and as far as technical assistance goes, we've been able to get some as well on some of these projects. So I feel that they've done an excellent job with helping our region. So thank you.
So we've got about 15 15 more minutes here, so you want to gather your ideas. Are there ideas or questions, and this is for the group, are there ideas or questions on other issues that we did not touch on today and that we should discuss before we end?
Well, everyone, just, if you could help me for just a second, though. How can I, as a constituent, or those in the audience as constituent, what bills, I'd be interested from learning from my standpoint, how can I lobby and what can I vote for and what can I get my Congress people to support that are in support of the good works you guys are doing? Are there specific bills, for instance, Senator Stefano, you mentioned a bill too quickly and I didn't catch the number. If I could trouble you to mention that again.
Sure. Senate Bill 1089.
Thank you.
And we could send you information also on different bills and what kind of support you can give. Obviously, the bill we spoke about today, we feel is because I think
what number is that bill?
What's the
5294.
I think what I'm hearing today is there's obviously we can tie economic development to attach it to the opioid crisis and how those two really. I think the further we look at this problem, the more it's becoming apparent that there's a key role, and we're all trying to find a way to solve this problem, and there's no silver bullet. That's what we all know. There's no silver bullet. It can't just be the federal government. It can't just be the community. It can't just be the state. It can't be the community leaders, the hospitals. It's going to take our country really coming together, and it's roundtables like this of listening to the people on the ground in the communities as to what's working, having the people who can, bring those ideas together is how we're going to finally solve this. And as Keith had mentioned earlier, it's a nonpartisan issue. This is, we don't have to let politics play a role in that. But at the same time, it's not just going to be government that's going to solve it. I think it's going to be all of us doing what we're doing, brainstorming here together. But we need the feedback to be able to go back to Washington and do our part, and as well as the federal agencies to hear, and you who are sometimes aren't heard and need to be heard, because we have to solve this problem. We're losing too many lives. I had a bill. Actually, I saw a Reuters report that there's federal dollars that go down to the states to treat babies that are born addicted. And only 9 states were actually using those federal dollars as to where they should be going. And every 25 minutes, a baby is born addicted to opioids. Every 25 minutes. So think how long we were here today. How many babies were brought into this world today and are addicts. And here the federal dollars weren't being used as they should. My point was, shame on us. Shame on the federal government for not holding people accountable for those dollars. Shame on the state for not making sure that it was being reported, and babies were being released back to their moms who are addicts. I had a constituent just out of Hazleton. She was an addict, and her baby was given to her. She rolled over on top of the baby while it was sleeping, 6-week-old baby, and suffocated it. So I think we all have to make sure, I know we have to have federal dollars, but we have to hold people accountable as well, that it's going to where it should be. So this is very important, and Ken, I don't know if you want to add something.
The good news is that I think over the last number of years, the focus of the country has really been on this situation. Several years ago, we passed the Comprehensive Addiction Recovery Act, which at the time we talked about being the first step. The elements of the 21st Century Cures Act, taking a look at addiction. With the Comprehensive Addiction Recovery Act, asking our agencies and grantees to start to evaluate the effectiveness of the programs. and we want to make sure that the funding that we have is going into effective programs. You're going to see a continued emphasis on that. The economic development, we see an economy right now that is healthier than it was several years ago, and we see a lot of opportunities coming to some of our communities with the Opportunity Zone program, to the extent that the Appalachian Regional Commission is gearing up for that. We're waiting for the IRS to promulgate regulations on that, but that's going to be a tremendous opportunity to attract private capital into regions that have struggled for a very long time. Looking here at the economy in Somerset County, the hit we took a number of years ago on mining, and to understand what that did to jobs, and not just the jobs at mines, but those that supplied, that the truckers, that ecosystem that was around that industry, and to look across Appalachia, these traditional industrial jobs that we are fighting to maintain through a healthier government attitude towards these, whether it's a regulatory environment, whether it's a tax environment, getting capital flowing again, because as we've learned today and as we know, there is a correlation between the economic health of the community and this addiction problem. We've got to have opportunity for people, where people have a vision of being able to get out there and being on the productive side, because I'm convinced that everybody wants to be there. And it's a matter of us having the right policies at all levels of government that are going to foster that and encourage it. So I really want to thank the Chairman Barletta for coming out and the work that we continue to do through the House of Representatives. Very often it gets stuck in the Senate. We have that phrase where that's stuck in the Senate. We did all this great work over the last several months on opioids, and I'm hopeful that the Senate is going to see the value in a lot of that work and get on the ball and help us address a number of these issues. But I really thank you for coming into the 12th District. And look forward to seeing you around.
Anyone else want to add?
I do want to comment. First off, welcome to rural Pennsylvania. I've always carried a little chip on my shoulder because we're rural Pennsylvania. Our voice, great leadership, but there's one where many have 20 or more. To sit and see this level of representation in my county, I just want to thank you, because one thing about rural Pennsylvania, probably because we do carry that chip, we have a tendency to get things done collaboratively. I know it's not that way in a lot of the urban markets, but it's very appreciated you're here listening. Just the conversations we've had, I see opportunities. So again, I'm really appreciative of you being here and taking this in, because again, it is rural Pennsylvania, but we are as deserving as anyone to have broadband. We are as deserving as anyone to have those opportunities and, to be underserved in that respect. But I don't think it's an issue. In about 2 months, we're going to cut a ribbon on a highway system that would not have happened had it not been for a collaborative effort of many, many people, organizations, counties, states. So it does work, and I, again, just want to comment.
And again, the important part is, we talked today about how broadband plays a role, much further than what people may think, and the role it can actually play in dealing with the opioid crisis here. So it was really beneficial.
I wanted to touch on something. We're speaking of broadband. It was probably 10, 12 years ago when I was county commissioner. I went to a rural broadband conference in Vermont, and one of the sessions at the time was rural electrics models. That's the whole reason why rural electrics were created, because of the same dynamics that we're facing now with broadband, and yet, as far as I know, we still do not have a rural electric in PA that is providing broadband. I know that some of the things are the regulations. I was told they're only allowed to do 85% of what they do has to be electric related. I still, 10, 12 years later, think that would be a great model for us to get broadband to the rural areas, and anything that can be done to change regulations, bring in experts that have done it in other states, anything like that to, I mean, they already have the customers, they've already, have the miles with the polls. For me, it just makes so much sense, and anything that can be done to encourage that, I think would go a long way.
Just to touch on the fact of broadband, and this would be in your basket too, is broadband is not considered a utility, so it's creating quite a problem in some of the areas we need to run cable. Fiber is not considered a utility, so that's a real problem in some areas. But I just want to say thank you for coming into the heartland, the heartland of the Laurel Highlands, into our district, and having this discussion. We've talked a lot. We've talked about solutions, how we make all those realities, and become a support network for the families that are dealing with this issue. I appreciate the opportunity.
Well, I want to reiterate the opioid abuse cost our nation $504 billion in 2015, and the legislation introduced in this roundtable are only the first steps. I believe we need to keep this conversation going. I look forward to working with all of you around this table to identify the next steps to maintain this dialogue, and I want to thank you all again for taking time out of your busy schedules, and for Keith for inviting me here and to be part of this roundtable. And this roundtable is concluded.
I'm scared.